How much of your expansion plan is hinged on the MVT dollar trust?
The industry is not getting, or the government has not, supported the organization or the hospital to market the MVT to that level. So we should have an umbrella organization along with the government so that we can market ourselves. As you said in the beginning, we have got expert doctors, very good nurses, all the paramedical staff. Everybody is expert in very good in Kerala. But still we are getting very, very minor percentage of the patients for the treatment here. The expansion plan that you are talking about, see, the present the facility what we have got is not enough to accommodate the present flow of the patients. So that we have got for the expansion. Of course, Radagiri Hospital or Aster is much bigger than the one which we are having. It is not that we are going to fill up the all the rooms or all the floors and all that, but we have to provide the maximum quality care to the patient. Then only we can attract the people.
I will rephrase the question. Now you have the pricing regulations coming in. It may hit some How much of MVT is necessary to maybe make such massive investments viable in the future? If you look at government regulation on pricing and imminent reality.
As we started, why we are charging more to accommodate the needy people. The same way, if we have to compensate the price reduction or the charge reduction or the revenue reduction, we have to increase and we have to go for the much in aggressive way for the MVT. We have to attract the patients, we have to bring the patients to the industry, to the state. Not only we can have everybody will survive. Everybody will survive, there will be no problem. Whether you don't get an MVT also, you will survive. But it is not. If we have to get more foreign money, more foreign currency, more revenue, we need more MVT.
Primarily, if you look at most of the Indian hospitals, not only in Kerala, we have all started the hospital keeping the thoughts in the mind that we are primarily going to serve for the Kerala population, not for the MVT. MVT has caught up only in the last decade. It is only adding your margin on the total what you are making. I don't think none of the hospital has designed to, except maybe Aster or maybe Rajagiri, which has come up recently here. Nothing has been designed to just meet the requirements of the foreign travelers. This is only adding value to the existing revenue what we are getting. So that is a point number one. I think the point which he made was that Kerala is having a highest travelers, general medical travel, not medical, general tourist. But if you look at the medical, it is only 5% of what is the travelers or medical value travelers who are coming in. So to add to this point, probably the general tourism, maybe the cultural tourism or Ayurveda tourism or whatever it is there a way that whether we can sync both, where we get, as Mr. Harish mentioned, Dr. Harish mentioned, that the general tourist population is good, quite good. But are we getting some kind of a promotion done through those travelers who are coming into the state of Kerala for medical value travel also? Is a big question which we need to ask. Is there a way by which, probably through the forum which we have developed, can have some kind of a meeting like this, where general tourist people are also involved, maybe hoteliers, Ayurveda developers, and promote the medical value travel also as a part of the overall tourism package. What is your
but I think till now, like I said, now it cannot be such a subsidiary now. Now it's the primary thing, because unless without MVT, I don't think we can survive. It has reached now, because when they put the cap on the prices and the salary is going up, margins are very, very low. So unless we go in for more MVT, I don't think hospitals can survive.
So one data point, since what you talked about, the good thing, let me explain also. It is no longer 5%. The good point of view is that the MVT travelers coming to Kerala is slowly spiking up, and it is because of lot of DTL activities. Because if you right now go into the digital forum and look at MVT Kerala, you find lots of stuff out there.
Around 10% now, isn't it?
Yeah, it slowly is increased.
Targeting 11
which
to
is
12%.
correct. So even without the society, without doing anything, the efforts of individual hospitals across the state is already showing the spin-off. The point which we need to discuss is it should be sustainable and it should be long term. See, Africa, when we talk about it, if you go to African countries, they are very reluctant to send patients to India. They are more keen for Indian hospitals to invest and create facilities in Africa. So it's not a long-term prospect. If you go to Maldives right now, Maldivians are also looking at which Indian hospitals can go and invest in Mali. So that traffic long-term may not happen. So we have to think out of the box of what is there in this space for us.
On that positive note of the overall share, national share of MVT spiking towards the 10% mark, we'll close the discussion, and what happens is we'll report the entire proceedings in the print edition as well as online, and a hard copy of this goes to the Minister and to the Secretary of Health as well, and you will have the videos on YouTube. With that, thank you all gentlemen for being part of this proceedings, and we hope to take this conversation forward along with you.
Sure.
For a better prospects in the space for people. Thank you.
Thank you.